Am I audible and visible? Let me know. Am I audible and visible? Am I audible? And am I audible? Let me check. Let me check then. Am I audible? Am I audible? So, sorry for the delay. Now, respiratory system. Welcome to Unacademy Future Doctors. I myself, Dr. Dipti Karya, I am MD PhD Physiology. I am Associate Professor and educating MBBS, MD, as well as nursing and physiotherapy students, and I have more than 17 years of teaching experience. Now, let me explain something about our subscription first. We have Plus subscription. Here you can choose the best from the best. You can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access Question Bank, which is having more than 25,000 questions. You can compete in the live test as well as quizzes. And within 12 months, we are coming with our printed notes. Next is Iconic subscription. Here, your access to the best from two of the best. Which are these two? One that is Unacademy and Prep Ladder with Unacademy, in which you can have well structured live batches, you can have recorded classes with full syllabus coverage, you can have question bank with more than 25,000 questions, competitive live test as well as quizzes, comprehensive printed and digital notes. Whereas in Unacademy and Prep Ladder with Prep Ladder, in this subscription, the features are: you can have clinical and integrated essentials. You can have video lectures from your dream team. You can have question bank 3 with active guidance, system tags, and more. Rapid revision and snapshots. Treasures in 2021 notes. You can subscribe from your mobile, either Plus or Iconic subscription. You can use my promo code DIPTI10 and get 10% discount on your subscription. Longer the subscription, cheaper are the rates. Another more thing which I would like to discuss, that is on this platform of Unacademy Future Doctors. We are posting all the videos for MBBS university exam going students, and this all videos, they are freely accessible. You can access all this video freely on this platform of Unacademy Future Doctors. Okay? Now, so today's topic, that is functions of respiratory system. One of the important topic may be asked as a full question in your exam. Okay? So now, starting with functions. Now, which are the main functions of respiratory system? Respiratory system has respiratory and non-respiratory, both the functions. Okay? So starting with respiratory function. So respiratory function, major respiratory function of respiratory system, that is one, that is exchange of gases between, you can see, atmosphere and our body cells. That is the respiratory function. And here, which includes pulmonary ventilations. First step, pulmonary, that is lungs. Ventilation means lungs are ventilated. So now here, air enters from atmosphere into the lung. That is first step. Second step, that is pulmonary diffusion. You can see here, from the alveoli, alveolar wall, across the respiratory membrane, this oxygen and carbon dioxide, they get exchanged. So that is pulmonary diffusion, second step. Okay. And third step, that is now this oxygenated blood that is transported. So transport of gases between blood and body cells. So this is major respiratory function of respiratory system. Okay. Next is this we have discussed first, that is pulmonary ventilation. Second, that is pulmonary diffusion. Okay. And third, that is transport of gases between blood and body cells. Okay. Now, so this is first function. Second function, that is warming, humidification and filtration of air. And this function is known as air conditioning. Warm, because suppose there is temperature which is less than normal temperature of body. So what happens? It gets warmed. Air gets warmed. Humidify if it is dry, and filtered. So these three things commonly known as air conditioning. Okay. Now, what is this filtration function? Which is important to prevent entry of foreign particles into the alveoli. So it prevents foreign particle to enter in the alveolus. Okay. So suppose you can see here, if the particle is large enough, if the size of particle is more than 10 micrometer diameter, these particles, they are trapped by hair in our nostril. Okay. Then second thing, if the particle is little bit smaller, 2 to 10 micrometer diameter. So what happens if the particle is small? Then it causes bronchoconstriction. Suppose these are our bronchi. So these bronchi are constricted. It will not allow the particle to enter inside the alveolus. And second thing, there is coughing. Along with bronchoconstriction, there is coughing. So it tries to remove the particle. That is one thing. And second thing is ciliary escalator action. You can see here, like escalator. I think you all of you have seen escalator. So it is continuously moving. So our cilia are also continuously beating. You can see. So if any particle here that is there that falls on the cilia, and continuous beating action of the cilia, that results in removal of the particle. Okay? And if suppose the particle is very small, less than 1 micrometer in diameter, then it may reach to the alveolus. In our alveolus, we have alveolar macrophages here. This macrophages, they cause phagocytosis, engulfment of particle. Okay, phagocytosis of the particle. So this is our respiratory. These are respiratory functions. First function, that is transport of gases between atmosphere and body cell. And second function, warming, humidification and filtration of air. These two are our which functions? Respiratory functions. Now we discuss about non-respiratory functions. There are 6 non-respiratory functions. The question may be like this: write down non-respiratory functions only. So they are, try to remember this, all 6 have other subtypes. So first one, that is functions of lung defense mechanism. Defense. Okay, immune function. Second, function of pulmonary circulation. Third, functions of respiratory muscles, metabolic functions. In speech also, respiratory system has an important role, and in acid-base balance. We will discuss one by one, starting with first. Functions of lung defense mechanism. They are, one is in our bronchial secretions. These are trachea and bronchi. Bronchial secretions, they contain immunoglobulin A. This immunoglobulin A, these are antibodies. So they protect against respiratory tract infection. Okay. That is one defensive action. Second, as we have discussed, ciliary escalator action. Cilia continuously beats and it protects against airborne infection. Like waterborne infection, same way airborne infection is there, that is protected by escalator action of the cilia. Third thing, as I told you, pulmonary alveolar macrophages. If suppose the particle is very small, it may enter in the alveolus, this is alveolus. In our alveolus, we have macrophage. So macrophage, what does it do? It first phagocytoses the particle. Phagocytosis means engulfment. Phagocytosis. Then second step is processing after phagocytosis. Third step, it also secretes substances for attraction, for you can say chemotaxis. Sorry, chemotaxis. We have substances secreted by alveolar macrophages and also stimulate formation of granulocytes and monocytes from bone marrow. What happens? This also are phagocytic cells. So this is about our lung defense, pulmonary alveolar macrophages. Next is cough reflex. Now, what is this cough reflex? What happens when irritant receptors which are present in our larynx, trachea and bronchi, when some irritant substance enters in our respiratory tract, these receptors are stimulated and these receptors, they cause coughing, and this coughing helps in removal of this foreign particle. So this is our first function, first non-respiratory function, that is function of lung defense, which is again four subtypes. One is immunoglobulin A, IgA, second ciliary escalator action, third pulmonary alveolar macrophages, and fourth is cough reflex. Now, second function, that is function of pulmonary circulation. Pulmonary circulation, it acts as a reservoir. What is this reservoir? Normally what happens, you can see here, left ventricular output here, amount of blood which is pumped by the left ventricle, that is equal to venous return. You can see here, blood coming through veins. But if sometimes this output is more than venous return, so what happens? We require more blood, and this blood, it comes from pulmonary circulation. So it acts as a reservoir to maintain left ventricular output. Normally what happens, output is equal to venous return or input. But if suppose output is increased more than venous return, so what happens? We require some blood, some extra blood, and that will come from the pulmonary circulation. So it is known as reservoir for the left ventricle. So that is function of pulmonary circulation. Next function of pulmonary circulation is, show you just a minute. Pulmonary circulation, it acts as a filter and it causes filtration because small capillaries are there. It causes filtration of blood clot, detached cancer cells, fat cell, gas bubbles, RBCs which are agglutinated RBCs, platelet masses, and stored blood debris. This debris means that is not useful product, stored blood debris. This all are filtered in pulmonary circulation. So that is second function of pulmonary circulation. Third function is removal of the fluid from alveoli. Now you can see here, suppose this is the alveolus, this is pulmonary capillary. Okay, so pulmonary capillary hydrostatic pressure here, that is low. So what happens if suppose hydrostatic pressure is high? Fluid will pass from this pulmonary capillaries into the alveoli. But here if the pressure is low here, what happens? There is suction. Fluid is absorbed from alveoli into the capillaries. So this is known as suction, or you can say that maintains or that keeps the alveoli dry. Okay, so this is removal of fluid from the alveoli. That is third function of the pulmonary circulation. Okay, first function of pulmonary circulation we have discussed, that is one, that is reservoir for the left ventricle. Second one acts as a filter, and third function, that is removal of fluid from the alveoli. Fourth function of pulmonary circulation, that is it plays an important role in the absorption of drugs, like certain anesthetic drugs. Previously they were given as the you can see aerosols, or sometimes some bronchodilators, they are also given through alveoli. They directly, you can see here, if that is in the alveolus, it can easily, if it passes through this membrane, it can easily enter in the circulation. So that is also the function of pulmonary circulation. Third function, that is the function of respiratory muscles. Respiratory muscles are important for laughing and singing. Fourth function, metabolic function, very important function, non-respiratory. That is secretion of surfactant. You can see here, these are type 2 alveolar epithelial cells or type 2 pneumocytes. They secrete surfactant. Now, what is the function of surfactant? Normally, alveoli, they have high surface tension. Surface tension means ability of the any surface to reduce surface area. So this is alveolus. Alveolus has alveoli, they try to reduce surface area. How? By collapsing. So all the alveoli, they have tendency to collapse. That is why, because of surface tension. Surface tension. Okay. And this surfactant decreases surface tension. Am I clear? Surface tension, that is the factor which increases tendency to collapse, tendency to decrease surface area, and this tendency is reduced by surfactant. This surfactant is produced by type 2 alveolar epithelial cells. Easily, if I can remember, I can tell you that suppose if you have a elastic or rubber that is getting collapse. So what you have to do is you have to just place something inside to prevent its collapse. So same thing here. In the alveoli, we have a layer of surfactant here to prevent its collapse. So what are the functions of surfactant? That it prevents the alveoli from collapse. Alveoli will not collapse. And if alveoli they collapse, what happens? Next time when we try to inflate the lung, we require more work. So work of breathing. If alveoli collapse, then work of breathing increases. So if surfactant is there, no collapse and decrease work of breathing. Third, it decreases pulmonary edema. Because if surfactant is not there, then fluid will enter in the interstitial space and produces edema. And it causes stability of alveoli. We will discuss in detail. Because otherwise, if what happens if surfactant is not there, then according to Laplace law, pressure is equal to 2T upon R. Means if the radius of the alveoli is less, pressure on this alveoli increases. What happens? Smaller alveoli, they have more pressure, so they will collapse easily. But surfactant prevents collapse of the smaller alveoli, so they give stability to the alveoli. Stabilize, they will not allow them to collapse. So these are the functions of surfactant. So first metabolic function is secretion of surfactant. It is very, very important for life. If anybody is having lack of surfactant, the person will die. Then second metabolic function, that is conversion of angiotensin 1 into angiotensin 2. Sorry. You can see here, this in renin angiotensin system we have discussed. Renin secreted by JG cells which converts angiotensinogen to angiotensin 1. Angiotensin 1 is converted into angiotensin 2 by angiotensin converting enzyme which is present in the lungs. Okay? And this is important for vasoconstriction to regulate blood pressure. Okay, so that is another metabolic function. Also, lungs are important for inactivation of some vasoactive substances like bradykinin. Try to remember these names: bradykinin, serotonin, norepinephrine, prostaglandins, and acetylcholine. All they are inactivated in lungs. Then next function is fibrinolytic mechanism. It causes lysis of the clot. Fibrinolytic mechanism. Then storage of hormones and biologically active substances like vasoactive intestinal peptide, substance P, cholecystokinin, pancreatosine, opioid peptides, somatostatin. These all are stored in the lungs. And last one, that is synthesis, storage and release of substances. Some substances are produced stored in the lungs and released when required, and they are prostaglandins, histamine, and kallikrein. These are the substances which are synthesized and stored. So this is about metabolic functions. We have discussed first function, lung defense mechanism, non-respiratory function. One is lung defense function. Second one, functions of pulmonary circulation. Third function, that is respiratory uh, muscles. They are important for laughing and thinking. Fourth, metabolic function. Metabolic function again, we have discussed, one is surfactant. Second, conversion of angiotensin 1 to angiotensin 2, inactivation of vasoactive substances, fibrinolytic mechanism, storage of hormones and biologically active substances, synthesis, storage, and release of substance. Then, fifth function, that is vocalization and phonation. For speech, we have various peripheral and central speech areas. Central speech areas are there in the brain, but peripheral speech areas, they are there. We require larynx, entry of air, larynx, articulation. For articulation, we have structures in the mouth, as well as we have respiratory passages, which are also important for phonation. And last but not least, function of respiratory system in the acid base balance. How? For acid base balance, our respiratory system helps in acid base balance by removal of carbon dioxide. How? Because carbon dioxide, when it is not removed, it combines with H2O and it forms carbonic acid H2CO3, which is further converted into H plus HCO3 minus, and this is acid, although weak acid, but it affects our pH. So by removing carbon dioxide, respiratory system also plays an important role in acid base balance. Okay? So these are all the functions of respiratory system. Questions from today's topic, that is one, non-respiratory functions of lungs and metabolic and endocrine functions of lungs. Or question may be functions of respiratory system, in which you have to explain both respiratory and non-respiratory functions. Okay, this is all. Thank you. Thanks for watching. If you like the video, you can like, you can share with your friends, and also you can subscribe our channel Unacademy Future Doctor. Thank you.